just a really quick YouTube video that talks about what is public health. And so we'll just kind of have you look at the landscape. They're actually going to put stickers wherever it's declared that this is a public health activity. So if we can just have you watch where the stickers go, then Yasmin and I will talk a little bit about that in terms of the careers in public health. So again, bicycles, you can see the ambulances. Water fountain, fruits and vegetables. No smoking. City transportation, bus services. Tobacco, water fountains, labeling, menus, it's like city disposal. Police departments, public safety, water, treatment, just about good. There. In silence, you got to see what public health is. At public health, we are actually looking at the environment in which you live, work, and play. And so we are going to actually highlight some of the public health activities here in Yellowstone County and the work that we're doing with regard to those activities. One of the important aspects is actually training in the area of public health. So not only the career and education component, but actually having training opportunities. And that's where you're up to tell them about a wonderful training opportunity.
Hello everyone, like Sean said, my name is Yasmin Odawa, and I am an employee of the Centers for Disease Control and Prevention. Does anyone know what the CDC is? Any idea? Good job. So actually, yeah, we control disease and a ton of other things. So it is actually the federal government's public health agency. And I was brought here through a program called PHAP, which is the Public Health Associate Program. And it's a 2-year paid, this is going to matter after you guys graduate, it's a 2-year paid training program with CDC, and they assign you to either a local, state, or tribal or territorial public health agency. So when we were talking about local and state, so Riverstone Health is the county's public health department, so Yellowstone County. The state would be, say, the Montana Department of Health and Human Services. Tribal would be, either Indian Health, so on the Crow or Reindeer reservations. Territorial would be Puerto Rico, Guam, all those health agencies. CDC quarantine stations. There are quarantine stations at almost every major airport, so that helps protect you from disease, and non-governmental organizations that work in health. It gives you hands-on public health experience without needing any prior experience. And this is going to sound like an oxymoron, but entry-level jobs now ask you for 2 years of experience, but pay you like you just graduated from college. So this one allows you to get hands-on experience while getting fair compensation. So we work in all areas in public health, so that includes chronic disease, environmental health, immunizations, injury and violence prevention, so that would be either suicide prevention, helmets, motor vehicles, maternal and child health, public health preparedness, and STD, TB, and or HIV, and other communicable diseases. So when we're talking about communicable, that's a disease that you can pass on to someone else. And where are we placed? So we're placed in almost every state other than the ones in brown. And there are over 320 associates across the United States and Puerto Rico. So while I work for CDC, I am placed at Riverstone. So that's a really unique way to get the perspective of working at a federal agency, but also really getting into the nitty-gritty of what you do at a local or state health department. So I do a bunch of stuff. In the beginning I did communicable disease work. So there are a list of reportable diseases. So if you get chlamydia or gonorrhea or salmonella or TB, there's a list of diseases that your doctor is required to pass on that information to the health department. And someone is required to follow up with you to make sure, have you been treated correctly, if you've exposed other people, and to get that contact information. So that was me. So I mainly worked on chlamydia and gonorrhea cases. So if we got a case report from a doctor saying Susie Q was diagnosed with chlamydia, I would give her a call. I would talk to her, make sure that she got the correct treatment. I would ask her about her partners and contact those partners confidentially. So I wouldn't say, hi John, this is Yasmin from the Public Health Department. Susie gave you gonorrhea, let's talk about how to get you treated. That is illegal, I can't do that. What I would say is, you've just been exposed to gonorrhea. Let's talk about how to get you treated, and let's talk about your partners if it goes on from there. So that's what I did a lot in my first year. I also worked on a salmonella outbreak. So we had one in town where people went to a restaurant and got sick, and we traced all that and made sure that everyone who had been ill was contacted. So we want to make sure that the diseases don't spread. So that's what I worked in my first year. And my second year, I'm actually coordinating a major grant that helps increase awareness of trauma and adverse childhood experiences, which is a major study through the CDC that connects negative experiences in childhood to long-term negative health outcomes. So if you had experienced any trauma in your childhood through a certain number of categories, they have correlated that, and there's been a very high correlation with that, with increased risks of diabetes, stroke, heart attack, increased STDs. So that's a community-wide initiative that I've been working on. And there's another video, but we don't have any sound.
Yeah, we don't. And so this one we can also watch.
Okay.
Will you just share a little bit about the application process? Because I think that's important to you and what they're looking for in terms of the degree.
Sure.
As you're coming into this program and the competition.
Sure. So it's, the application opens in January. You need to apply within 2 years of graduating college. So it's what's called a Pathways program, so that requires at least 2 years after you graduate. You can apply the winter of your senior year. So if you're graduating that summer, you can apply in January. The application season is really short, it's a week, you have to get it in. It is highly competitive. I think about 5,000 people, 3,000 to 5,000 people apply, and they select from 150 to 200. What they're looking for is a bachelor's degree or a master's, if you're interested in going to school right after you're done with your undergrad. It pays pretty well in the sense of government work, but not like you're going to buy a Mercedes tomorrow. And you do get a raise in your second year that's quite significant. So I would recommend if anyone has any questions, you can come up and ask, but Sean's going to talk to you about what public health is at Riverstone.
So we're actually going to leave some time for questions too as we go through the different occupations. And we're hoping that you guys will dialogue with us. We want this to be interactive. This is about a 1-minute video. Of course, this needs more techie. Really, it's pretty visual. What this is going to actually look at is what happens in public health. And I'm going to correlate this video to the positions that we have in Yellowstone County.
So do you guys catch it?
Without emotion. So public health, public health system is actually working, is actually working. You're not going to see us at work because that is the clean drinking water. You actually probably want us to get there. That is the clean drinking water, sewage too, that it's disposed of in the correct fashion, that garbage collection is occurring on a regular basis, much like Yasmin talked about, that communicable diseases are being managed in your community. If you go out to eat in the public, you're actually going into a restaurant that's been inspected and has the seal of the health department with regard to how they provide services in the restaurant and the types of services that you receive. So at Riverstone Health, we have a really large organization that has a variety of businesses. So we have, if you look over on this far side, we have information systems, communications, human resources, but we also have a clinic where we're providing medical care. We have a home care and hospice program. We have a medical residency program. We have physicians that are being trained in the community, and then we have public health. You can jump in too. You want to take this one?
Sure.
Okay.
So public health services is cut up into 4 divisions. So community health is, we'll discuss more. So community health, population health, family health, and environmental health services. So these are all the major components of public health. In different health departments, you'll see them set up differently, but these are sort of the major divisions of public health.
So at Riverstone Health, we have approximately 80 employees that are providing public health in Yellowstone County. Some of the services that we actually provide, as we detail that, may go into more of a regional structure, but most of those employees are actually working in Yellowstone County with the services that we're providing. Would you like to talk about community?
Sure. So community health helps you with immunizations. So making sure, so we have an immunizations clinic where you can get all the required immunizations for school, for travel, communicable disease, so that's where I worked. So that's anything from STDs to gastrointestinal communicable diseases, and that's where we have our public health nurses. Cancer control, we have a program that helps people get cancer screening, so colonoscopies, pap smears, or mammograms for people who do not have the funds to do so. And we also have an HIV clinic, which is a Ryan White clinic, and it's case management, and it's also a clinic for people who have HIV, just to make sure that they have all the resources available for them to live a healthy life. So in immunizations, we have nurses, communicable disease, we have nurses and prevention health specialists, which would be like a bachelor level that doesn't require any sort of clinical experience. Cancer control, we have prevention health specialists. In an HIV clinic, we have nurses, case managers, physicians, and physician assistants. This is sort of, to me, the most exciting part of public health. Like, this is where you get any outbreaks, or remember when Ebola was like a big thing. Communicable disease was the department tasked with monitoring people. So if you had flown in from any of the countries that have been affected, I had to call you every day for 21 days, on Saturdays and Sundays too, and ask you about your temperature and ask you if you were experiencing any symptoms, just to make sure that you were okay. And if you weren't, you had a special phone that you called, and there was a whole protocol to make sure that you were transported safely to a hospital to get evaluated. So this is sort of where you see all those like outbreak movies and all that. This is in this department.
Great, thank you. Population health services. This is actually our initiative in the community to look at community health improvement and the population activities. So we have a number of activities. Tobacco prevention. We're actually going into the middle schools and we're forming clubs with kids before they start smoking with the React Against Corporate Tobacco, so that they have an opportunity to make a decision about tobacco use before they even start. What the national statistics are saying, that if you initiate tobacco use in your adolescence, chances are you'll continue to smoke through your adulthood. So that's actually a prevention activity, and we have a couple of prevention health specialists, again, bachelor's level prepared individuals that are in the community, working with the schools, working with students on stop smoking before they smoke. Then we have emergency preparedness. So this is actually an activity where we're working in a multi-sectorial group in Billings, police departments, hospitals, the Department of Emergency Services, a very number of positions where we're actually saying, if there's an emergency in Yellowstone County, we'll all come together to respond to that emergency. So the one that we train for is anthrax. If anthrax shows up in a business, if it shows up at the post office, we mobilize this team and we come together to make sure that each one of you can actually have medication if that's needed in our community. So about 7 years ago, we did what we called the Community Flu Challenge, where we brought all of our resources together at Metro Park and said, okay, community, we want to see if we can set up a pod to be able to dispense medication to you in a timely manner. So everybody come to the Metro to have your flu shots that day. And we were able to serve, I think it was over 7,000 individuals on that day to show that we had capacity and we could surge and that we could provide protection if our community needed it. So we exercise on a regular basis with the partners. It's an event that we invite the public to. We're actually going to have an exercise in 1st of June, isn't it? Is it?
Sometime in June.
Sometime in June. And the exercise is a tornado hits Billings, and so we'll actually mobilize from that, and it will be a public health exercise this year where everybody's involved. So stay tuned. There will probably be some press and media. We invite the public to come out and participate with us. Lead poisoning prevention. Have you all heard of Flint, Michigan, where the water system actually contained lead, and there was a concern about children's health, specifically children's health with regard to lead poisoning. That is a new initiative in Yellowstone County. We're actually beginning to look at elevated lead levels as a reportable concern from the state health department. So when providers are testing children and their blood lead levels, they're actually reporting it to the state health department and then to us. So we're starting those activities. Worksite wellness. Who knows about wellness? Well, if we're talking about public health in the community, we're also talking about our own wellness. And so we've begun initiatives internally at our organization to look at blood draws on an annual basis to make sure that individuals have access to insurance, to talk about what you can do to increase your own health and your own health awareness too. So that's an important initiative for us. Healthy by Design, that's our community coalition that's actually looking at the health of your community. Every 3 years we do a community health needs assessment, and in that assessment we are actually calling the demographics and buildings that represent our demographic. So if they're looking for a 50-plus-year-old woman, they're calling me and saying, will you answer my survey? And they're doing that by geographic area, they're doing that by age, they're doing that by all of the demographics that we've identified. Then we're looking at secondary sources of data to say, we need people to give us information about what's important to our community. So all of these positions are actually bachelor's or master's prepared clinicians, not specifically involved with sciences, but marketing, communications, health promotion, disease control.
I'm a bio major, so.
Talk to these people. Are most of you in biology too? Okay. Community health improvement, similar to our Healthy by Design initiative, really is community partners working together. And then our school nurse program is actually placing school nurses at schools to begin looking at making sure kids come to school with immunizations, but also those health promotion activities, tobacco prevention, exercise, good nutrition, any of those core needs that the students would have. So any questions with regard to those two types of jobs or the divisions in public health? Okay, we're going to keep going. Family health services. This is actually one of our clinical components. So the WIC program provides nutritional supplements to women, infants, and children, and they're doing that through nutrition education and providing some commodities. So you can go to the store with your WIC vouchers and pick up eggs, cheese, peanut butter, milk, cereal, beans. Any of those core nutritional supplements that help with kids' nutrition and pregnant women, and also breastfeeding women's nutrition. This program, combined with maternal child home visiting, is actually our core activities for visiting pregnant women, their infants, and then children through school age if there's a need with regard to their health. So in this program then, we're using nurses, dietitians who have a nutrition degree, and have gone through a year of internship, social workers, minimum bachelor's prepared, and community health workers. Environmental sciences. Your biology majors, this is where you land. In environmental health, we are actually in the community. So in that last video that we played, that is your community with regard to environmental health. We're looking at the structure of the community. We have 10 sanitarians that are doing the restaurant inspections, septic and pool inspections. They're actually licensing body artists in town to make sure that their sanitation, they're using correct procedures, that they're first aid trained. They are our regulatory arm. They are responding to complaints from the community. So if you have a concern about maybe an illness after eating at a restaurant, it starts here, and then it moves to Yasmin and communicable disease. Do you want to detail that process a little bit with foodborne illness?
Sure. So if you do have a complaint, you do have the right to call environmental health, and then they get in touch with us in communicable disease, and there's a sort of questionnaire that you ask that asks you what you ate, where you ate for the past 2 weeks. So usually people think, hey, I ate at Subway yesterday and I'm not feeling well. It's definitely the Subway. I've had so many cases of people tell me that, and I'm like, it's not, because I know there are like 10 other people that got sick at this one place and you ate there. So it's not necessarily like the exact last place that you ate. We trace everything that you've eaten, not just out. So if you bought something from the grocery store, if someone made you cookies, we talk all about that. And then if there's further concern, we would go further into a much more detailed questionnaire.
So what is lacking at our health department, which is state supported right now, is an epidemiologist. Somebody that's master's prepared in public health that has the ability to actually look at not only the environmental health piece that's coming in, but the disease control piece, and help us with the surveying and then the response to the surveys to make sure that we're looking at all of the areas that need to be examined with regard to foodborne illness outbreaks and additional communicable disease issues. So in the epidemiology world, probably that's one of the growing marketing areas for public health right now, is there is a need to base all of our work on science and evidence-based practice, and having that person who really is instrumental in both the data collection and the analysis is key to everything that we're doing. So we are supported by the state health department with regard to the epi piece. This component is important to us as we look at the growing future of public health and the need to have the workforce development. It means talking about the CDC helping us with the ground up effort to grow public health professionals. In our own area, in Yellowstone County, we are really trying to appeal to that market share of individuals that want to be public health nurses or want to be sanitarians and see that specific niche for themselves. And so we have training programs in place. In environmental health, we have a sanitarian and training program. So you have to come into the program with at least 30 semester hours of the physical or biological sciences. And then we begin the process in a year-long training assignment to help prepare you for a licensing exam. So our sanitarians are actually the trainers with regard to that sanitarian and training, and taking you through the motions to be able to have this program in place. Likewise, we're also doing that in the WIC program with the nutrition educators, because they require that a nutrition educator come into the program with a minimum of an associate's degree, but with college level anatomy and physiology and at least 6 semester credit hours for nutrition. And so at that point then, we began the process of, we call them a competent professional authority, which is a nutrition educator in training until they go through all of the modules and the training opportunities before they can actually be placed in that position to do the services themselves. So we're looking at what our need is in the community. In the last 24 years, I've been employed at Riverstone Health. Public health services has grown from probably the size of 10 people responding to communicable disease, maternal child health services, school nursing, some alignment with home care and hospice that really wasn't public health, but we were sharing some of the services of nurses to 80 individuals. So it's a growing field, definitely a need. And as we go back to look at the community, you can actually look at your infrastructure. So I was at a city council meeting on Monday night, and they were looking at complete streets. You guys read the paper? No. Anybody hear about complete streets? No? Well, it's really controversial, so I'm going to put the bug in your ear. Complete Streets says that we have the opportunity, we have a policy that says we shall, whenever there's a review for an arterial in our community, look at how transportation is in place. So how cars travel, how pedestrians travel, how bikes travel. Do you guys ride bikes? Mm-hmm. Yeah, where's the safe route to ride your bike?
Against traffic.
Mm-hmm. Yeah. Are you guys riding in the bike lanes anywhere in town? Where you've
Or on
seen
trails.
the trails? Because that's a safe place without motorized vehicles. Have you been down Lewis Avenue where there's actually some width in the street, there's some room on each side, or on one side, parking on one side, and then there's actually some signage within the street that says bikes are also present in this road. And so it's a user situation where anybody can use the road. The pace is slow on Lewis Avenue as a result. I think it's a 25-mile-per-hour speed limit. So when we look at public health, we're looking at community health specialists, bachelor's prepared individuals that are organizing these grassroots efforts in our community to look at the infrastructure, to look at complete streets, that everybody has the right to use the roadway. We're looking at the water system. So when our sanitarians go out to inspect a new subdivision that's building west of town and it's on a septic tank, you're making sure that the water in that area is protected based on the type of septic tank that is actually installed. When we're looking at tattoos, did I get anybody's attention? Anybody gotten a tattoo recently?
Not recently.
Not recently. So how did you know that that artist was safe?
I just went in there and got it.
So we're working behind the scenes to make sure that that's happening for you.
Thank you for your work.
Yeah, we are. So, and I think the industry appreciates that too. So everybody's held to the same level of accountability. They're all asked to be certified or licensed in the same way. And so there is behind the scenes the work that's being done. Our sanitarians are actually going out. What happens if you've been in a building and you can smell mold? No, it's not good for you. You know, if you're there for a long period of time, there are some concerns that it could be a health concern. What do you do with that information? Have you guys all smelled mold? You know what it smells like, that really damp, musty smell times 10? What would you do with that information? Well, call public health. If you called us, what we would probably try to do, because that's probably in a private citizen's home, is provide education. So that's the other component that goes along with each one of our positions in public health, is that we're in the community actually providing that education to make sure you know what your responses are and what your responsibilities are. If it's a licensing responsibility, we're going to tell you that we'll license you and what your rules and responsibilities are. If it's a situation like mold in the house, we're actually going to respond to give you information, what we call handouts or toolkits, to tell you this is what's going on, and that we can respond not as an infraction of public health law, but as a member of the team that's helping guide best practice. What about bed bugs? Does that ever come to the forefront of your discussion? No? Ever thought about it? Does anybody go into a room and ever check for bed bugs if you haven't stayed there before? What do you do?
Check under the sheets and stuff.
Check the corners, look and see if you can see any spots. Well, what's happened with bed bugs is that isn't a public health concern, just with regard to the spread of disease, but it is a nuisance, and people are concerned about that. And so one of our opportunities as a public health department was to have our health promotion specialist bring an expert on bed bugs to buildings, and to invite hotels, motels, hospitals, any place where there was a group living situation in to listen to that discussion so that they knew how to respond whenever there's a concern in the community. So that's the infrastructure at work with regard to public health. Can you think of other things that they need to know?
In terms of environmental.
Or any of our positions?
So we offer free HIV tests. If you do come in contact with, say, chlamydia or gonorrhea, we can treat you for that at low cost or no cost. There's a lot that we do, a lot that you hopefully never find out about.
Right.
Not because we're hiding anything, but just because
We're at work.
Yeah, because when we work best, there's not a problem.
Yeah. So the funding, Yasmin talked a little bit about salaries. If you're coming into Yellowstone County as an entry-level health prevention specialist, you're probably starting anywhere from $17 to $18 an hour. If you're coming in as a licensed sanitarian, where you've already gone through the environmental health licensing process, you've been basically vetted, you have the credentials with your biology degree, then we're probably looking at $23 to $24 an hour. So those comparisons are probably alike in other health departments across Montana. We try to make sure that we're competitive in order to keep these positions open. Public health nursing is probably our weak link right now because we can't compete with the hospitals. So what we do offer is a schedule that is probably more conducive to a work-life balance where you're not working 24 hours a day or on those varied shifts unless there's an emergency. Our nurses probably entry level $22 to $23 an hour, and then progressively they go up with the scale. We're trying to be really proactive in terms of recruiting nurses because that is an area where we've lost our workforce through either nursing programs not being available to students that are applying, and so the workforce has declined there, or individuals are making the choice to work at higher paying jobs in other areas like the hospitals and clinics. So do you have questions for us? Anything that interests you in public health? Yeah.
Is there any involvement with mental health?
Well, there is. So, and what we have done is mental health is really wrapped through the clinical services more so. So if you come into the Ryan White Clinic, we're actually doing a depression screening. If you're seeing a case manager for the maternal child health program or a social worker, we're actually doing those screenings and making those referrals. We don't have mental health clinicians on the public health team right now, but we do have the trauma-informed care project, and maybe you could talk a little bit more about that for mental health.
Sure. So when I was mentioning before that association between trauma in childhood and negative health outcomes, what we're doing in public health is educating our providers, our staff on trauma and its effects so that they can be better providers and that they can be better informed. So that's our approach right now. So it's more about education and then figuring out ways to refer our patients and our clients, if necessary, to resources in the community.
So it isn't providing the counseling, but making those connections and being aware.
But there are other health departments in the country that do have, I know there's somewhere that has a Department of Mental Hygiene. That's what they used to call mental health back in the day, mental behavioral health. So I think in much larger departments they might, but not in those. Okay. we provide education.
So when I talked about our community health improvement activities, we have 3 priorities in Yellowstone County that we're working on. One is physical activity and nutrition. The second is access to care, making sure that individuals have access to insurance, that they have a primary care provider. If they're frequently using the emergency room instead of their physician, then we're working on activities to try to help people and direct them to the most appropriate level of care. The third priority is mental health. And so this trauma-informed care grant was our initial step into a community effort to begin looking at mental health. And then we're trying to align all of the efforts in the community on mental health so that we begin to see the bigger picture and what the needs are. With regard to the workforce in mental health, it's actually training clinicians. So we have a master's social work program at Walla Walla University here in Billings, making sure that their clinicians that are coming out of that program have enough hours in clinical practice to be licensed is one of our activities of the trauma-informed care grant.
Since you guys are a federal funded program, do you guys have loan repayment through your jobs?
We do. So 2 things are happening. When you look at Riverstone Health in our organizational chart, our clinical services are a federally qualified health center. And so there is loan repayment for any of the medical providers that are within that clinic. Likewise, the nurses within public health are being offered loan repayment right now. And so it is beginning to create opportunities for payback.
And there is a program that I think if you pay all of your student loan bills, I think the federal ones, within 10 years, they get, after 10 years your debt is taken away if you work in a nonprofit or a governmental organization, so it's account. But that means you have to make every payment. They will not, if you miss one because you forgot, they don't really care. You have to start over again. But that is one benefit I think of working in nonprofits or governmental organizations, regardless of your degree.
Other questions? We want you in public health. Your biology degrees are useful, they're valued, and we need you behind the scenes. So think about us. Riverstone Health, we have a website. If you're interested, all of our programs are detailed on the website. Likewise, you can go in, kind of look at the HR resources that are available, our human resources on there. If you have questions, I'm on that website. Sean Hines, Yasmin, are you listed on the website?
No, there's just, I can.
Okay.
Yeah.
Yep. So you go to public health and ask for her. Either one of us would respond to an inquiry or an email.
Any questions, anything at all, anything crazy or weird or we're preparing for something? No? No one's interested in the preparations for the zombie outbreaks?
What about Zika? Yeah.
That was actually real. But I mean, if you go on the CDC's website, they actually have like a zombie outbreak page. It's like a joke, but it might be serious. Who knows? Any other questions? Thoughts or anything?
Apologize for the YouTube's not working. If you're interested, they are on YouTube, but it's public health, and then the public health logo when it gives you the background. So,
Thank you.
thank you very much.
All right, so for your homework, there's going to be a survey that pops up on Moodle that you'll need to take, and it's just going to be about